Well, hello and happy Public Health Thank You Day. Thank you to all the public health professionals and all of those who support public health. And so, what is public health? Say, I've been in public health for past 20 years in a variety of different settings. But public health is the science and the practice of protecting and improving our communities. We do this through education, disease prevention, and policy making. And we also do research on disease, how to prevent diseases and injuries. And so my career started out, I always say that public health isn't a job. It is something you're chosen to do, right? It's a it's an act of service because we're looking at improving health and diseases among the entire population. And so my journey started off in the United States military. I say public health chose me because it really did. I went in open general in 2006. And going in open general meant that I didn't have a job when I went into public health. I went into the military. And so the military chose it for me. When they initially chose public health, and I got to look at where I'm going and what my job was going to be, I said, what is this? And what is public health? Somebody looked over at me and they said, oh, you work in the chow halls, so the dining facilities. And I'm like, oh, I can't cook. That is not a place for me. I do not want to do this job. And little did I know, I look to the corner of my eyes and I see a girl crying, and she had gotten security forces. So that was a police officer in the military base. And in that moment, I looked over her and I'm like, hey, you want to trade? I'll be a cop. It's like, I'm not doing this public health stuff. And so we tried. We actually went through the facility and got to actually ask to see if there was a way for us to change. And they said, no. They said, you're stuck with whatever you got. And so we went off to our training schools after that to actually get on, skills, job training and knowledge. Um, and I was at the School of Public Health in the Air Force. And during that first day, they said, who doesn't want to be here? Who doesn't know what public health is and doesn't want anything to do with it? And I raised my hand straight up and said, no, not me. They didn't want to be here. And they said, just give us some time. And at the end of these 13 weeks, this may change your mind. And I said, I'll be optimistic about that. And going in, public health, and I got to do so many variety of different things for somebody who gets bored easily and somebody who needs constant change. Public health gave me that and so much more. One minute I was inspecting food. So that's what we did. We didn't actually work in the chow hall. We inspected the food, ensured that was safe and up to regulations so that people didn't get sick. And so going in and checking the food, checking the hotels for safety and sanitation practices, doing interviews with to prevent communicable diseases, doing education and briefings. Everything was changed. And then the next minute I would be outside and I would do entomology and be trapping mosquitoes and collecting and doing research and analysis. And then next minute we would have a food outbreak. And so now I'm investigating and trying to see where is this coming from? Where did it start? How did it start? And so I just got to bounce around to so many different areas. And that's what really sparked my interest and love for public health. And I have been doing this for 20 years now. Once I got out, public health was my first job, and then also first job out of the military was going into as a public health professional in the health department, the state health department. And so from there, the journey continues. Now, after being 20 years in and doing all of this work in public health in many different areas, from hospital systems to health departments, and working with the community, what I really enjoyed the most was the one-on-one, boots on the ground community work. What I really enjoy is being able to serve everyone. We are of service to all people in our communities, and providing them what they need and connecting them to resources. And that's what I enjoy the most, is how can I connect people to what they need when they need it or before they need it, and to ensure that they're ready and able. And so, with that now, what I'm doing is I'm helping those who serve others. Now my calling is I've done the work I know what it takes. I know the burden that we carry with the pain that we see our communities in and how we want to fight effortlessly to save them. And we see now that some of the value, of public health is being questioned. And so I know what that feels like, and I know how these leaders in public health will be struggling. And so my role now as a leadership health strategist is to help organizations and those leaders who serve others ensure that they have the proper, health and strategies to pour back into themselves. So as a coach, is coaching them through their leadership journey and supporting them as they grow and who they're becoming, but looking at it from a holistic approach. So the whole health concept of the whole person, and knowing that our mind, our body, our spirit is all interconnected in emotions and everything that we do. And so helping these leaders navigate the changes that are occurring, and helping them support their teams in a better way, as well as when we have healthy leaders and healthy roots, they grow healthy leaders. And those healthy leaders are healthier workplaces as well as healthier communities. But it all starts at the roots. And so that's what I'm working on is some root work with Creed Consulting. So thank you, public health. Thank you, all the public health professionals and everything that you do every day.